Emily Whitehead was just 5 years old when her mother, Carrie, noticed some alarming symptoms. Carrie researched them online.
Bruising, gum bleeding, nosebleeds, and the first thing that pops up is leukemia.
Emily had ALL, acute lymphoblastic leukemia, a disease that is curable in most children who go through chemotherapy. But Emily was among the 15% of children for whom chemo didn't work. She thinks her dog Lucy knew it first when her cancer came back.
She wouldn't play with me or anything. She would just sit.
Do you think she knew you were sick?
Yeah.
Emily's family turned to an experimental therapy at the Children's Hospital of Philadelphia. Dr. Stephen Grupp is leading the study.
The idea is that we're redirecting the cells of the immune system against the cancer.
Scientists use the patient's own immune cells called T cells, white blood cells that help fight infections. They remove the T cells, genetically engineer them to attack leukemia cells, and inject them back into the patient. The engineered T cell in gray attacks the cancer cell tinted green.
This is a whole new way of treating cancer.
Emily received an infusion of her engineered T cells last April. She suffered life-threatening complications.
They took us out in the hall and said, there is no room to get sicker. She is as sick as you can get. They said, you should call your family in. There's a pretty good chance she won't be here in the morning.
Doctors managed the toxic effects, and 10 days later, she showed dramatic improvement.
We can't find any leukemia in her body using the most sensitive tests that we have.
I thought we were witnessing a miracle.
Because you had been through so much, and she had been through so much already.
Yeah. When he told us that news, I looked at Carrie and I said, she's going to get better.
Emily has been cancer-free for 8 months. Researchers are examining whether the treatment can be used on other cancers, too. Elaine Quijano, CBS News, Phillipsburg, Pennsylvania.